In tonight's Health Watch, could taking a single pill make a big difference in heart disease?
That's what Vanderbilt researchers have been studying in a year-long trial. CBS 2's Dr. Max Gomez here with more.
That's right. And researchers call it a polypill, and that's because it's actually a combination of 4 drugs, 3 for blood pressure and 1 for cholesterol. Doctors have been studying different polypill combinations for some time, mostly in low and middle income countries. This one is the first to be studied in the U.S. Retired police officer Henrik Pitch takes a lot of pills to manage his diabetes and high blood pressure.
When I was taking the medication consisting of a variety of tablets, I'd have either 5, 6 or 7 tablets.
It's a common complaint among heart patients with multiple risk factors, high blood pressure, high cholesterol, and it often takes several drugs to control those risk factors. So what happens?
People are not taking the pills that they are supposed to. Patients, for example, with a high cholesterol level that would supposed to take a statin, in fact, only 50% are doing it.
Dr. Valentin Fuster is a physician-in-chief and chairman of cardiology of the Mount Sinai Health System. He's also led several international studies on polypills. He's found that combining several drugs into a single pill results in a major reduction in cardiovascular risk factors.
People take the polypill, but people do not take when you give many pills together.
In the new study in the New England Journal of Medicine, Vanderbilt researchers found that low-income residents in an Alabama community who took a blood pressure cholesterol polypill lowered those risk factors enough to translate into a 25% reduction in the possibility of having a cardiovascular event like stroke or heart attack. The findings are similar to what Dr. Fuster has seen internationally.
This is really the clue for why the polypill, at least from a theoretical point of view, could have many advantages.
In other words, it's all about patient compliance with taking their prescribed medications, and one pill is more likely than 3, 4, or 5 to be adhered to. Now, the one weakness in the present study is that it extrapolated from markers like high blood pressure and cholesterol to predict heart disease lowering. The gold standard is to look at outcomes, actual heart attacks and strokes. Those studies take much longer and are much more expensive, although Dr. Fuster is doing one of those studies internationally, and they'll prove then that the polypill really is something that we ought to take. If you remember to take 5 or 6 pills, you'll get the same effect, but it's a lot easier to take that one pill.
Fascinating psychology. But it seems these pills work.
Absolutely. Oh, absolutely they work. If you lower that blood pressure and lower your cholesterol, you're going to lower your risk.
No doubt. All
Thank
right.
you, Dr. Max.
You bet.